Hello, everyone. I am so excited to be here with you all today to close out this great day of programming and dialogues that you've had at the Health Tech Hiring Forum. I hope that you had a great chance to make some great connections, explore opportunities to serve your community, advance public health in your community, and to better understand, the positive impact that your work will have on the people's lives through public service. Want to start with just introducing myself. Why am I here? Why are you listening to me? So I think it may be helpful just to share a little bit of my background. So the first 7 years of my career, I was trained as a biomedical engineer, serving people with disabilities at the state level. So I've had the privilege to serve in the state of West Virginia as its first female rehabilitation engineer, as well as served in the great state of Massachusetts. I know Boston has been one of the virtual booth in the room. So hello to folks from Boston. And in that capacity as engineer, I got to work with individuals with disabilities, supporting their families in their goals for independent living, for vocation, for education. And in that first 7 years, it was such a privilege to serve folks individual by individual. But working in a state agency, there was always the context of public policy and how can I extend the programmatic reach of the work that I did to even more folks beyond the individuals that I had served. And so I had the great opportunity to move from Boston to Washington D.C. and work for a nonprofit called the Association for University Centers on Disability, where I got to marry my disability knowledge and started to learn about public health. And I quickly learned that to be successful, I need to learn and be fluent in the language of public health. And I went back to school at that point and pursued my PhD in public health and epidemiology specifically. And then I had the amazing opportunity to join federal service in 2009, and to bring forth the knowledge, the job experiences I've had at the state level, to then bring into this federal domain, and then continue my public service. And so I think those of you that are interested in civic tech, wanting to contribute your work, your efforts, and your knowledge and technology into public health, I will say that I have a lived experience, and I'm so excited that you have taken the time to join this virtual job fair this afternoon and to learn about the opportunities at the public health authorities that have been at the booth dialoguing with you. I think just some key messages to drive home this afternoon is that your participation in this job fair, and the work at the public health authorities is really an opportunity to join an organization where technology, data expertise are going to be, leveraged and used to save lives and improve the health outcomes at a national scale. All of us just came out of the COVID pandemic and know that the intersect of data and public health is incredibly important, and that the public health systems are going to benefit so much from thoughtful data modernization moving forward. So, you're coming to a time where we'll be able to fully utilize your skills, and you can directly contribute to the well-being of the communities that you will be serving. I think the other part of it is that you're part of a national community of folks that are bringing public health, engineering, and tech disciplines together to advance public health. And so you're part of a greater family. And I think for the folks that come to join this new data office that we formed at CDC in the summer of 2023, I always characterize it as you're joining our family. And so those of you that are thinking about joining our family, this is a great time to be able to do that. This effort is really looking at transforming and modernizing public health data infrastructure, and we've got bold, audacious goals to support health outcomes and public health impact in local communities. I think the other piece, to continue to share the excitement of being part of this, initiative, is that it is an unparalleled opportunity to utilize and further develop your skills in a really new, innovative, challenging way, where we're tackling really complex problems at the intersect of technology, data, and public health. We want you to bring your experience to tell us, give us your perspective, and we want you to be able to contribute to an interdisciplinary team of passionate public health professionals at the public health authorities to navigate, our the public health challenges ahead. And so I think, if you're looking, if you're a tech person looking for the opportunity to expand your horizon, explore. The world of public service, this really is a place for you. I think, I just want to acknowledge and thank you all for spending the time to join today's health tech hiring fair. I just got a quick note on the numbers because, being an engineer and an epidemiologist, I love data. And so I know that over 270 folks have joined us this afternoon. 270, how amazing. And I think, the booth that are hosted by the Public Health Authority also have incredibly robust chats and dialogues with those of you that have joined us this afternoon. So I think, if there was an agency that you have interacted with this afternoon that are doing work that you're very interested in, please continue to keep an eye on their websites, for the initiative they're advancing. And then I think, also wanting to take this opportunity to acknowledge the organizers of this, as well as the CDC Foundation, for their collaborative work with us in this space. I want to say that, there's a couple of reminders, because there's things, logistical details that I want to share with you, this afternoon, to make sure that, if you're interested and you want to pursue that, there'll be appropriate follow-ups for these things to happen. So, as a quick reminder, if you haven't done so already, be sure to update your Brazen profile, that includes your resume and a link to your LinkedIn profile. Following the event, members of the Tech Talent Project team will be reviewing your profiles, and then we'll be in touch with you if your skills are a match for a role that's currently available. And then I think, if you're interested in more information about available job opportunities, please continue to monitor the CDC Foundation webpage, www.cdcfoundation.org. I want to just close by thanking you again for spending the afternoon at the virtual job fair. Thank you for your interest. We are so excited for this opportunity to bring tech talent into the public health domain, and know that you will make a great impact in the work ahead.